really from last autumn, whenever as an organisation and as a group of partners, we became one of the pioneer sites. We have set about developing a programme of work which Louise Hardy has been leading on behalf of the CCG, working across each of our organisations and involving local councils, Health Watch and so forth. And our ambition is to develop really joined up care for everyone across all of southern Devon and Torbay and beyond. One of the factors that we face on an annual basis within the geography of our area is the fact that the population swells by over 100,000 in the summer months, and that is a factor that we have to bear in mind when we think about integrated care, both health and social care. So our ambition is around excellent joined up care for all of our citizens. And I know that having looked at the work that's being done nationally in terms of the integration pioneers, a lot of what I'm about to say in the next few minutes will be quite similar to, I think, what other colleagues are doing. And certainly Jane Viner, my colleague in South Devon Healthcare Foundation Trust, has led the way on developing this, let's call it a concept around the whole lifespan, from early years through childhood to young adulthood, active aging, and over time to frail elderly. So we call that the life course model, and our ambition is to enable young people to start well, to develop well, to live and work well, and to age well. And the demographic challenges that we have in South Devon and in Torbay are very similar to what other colleagues will experience. We have a lot of issues in terms of young people's health and safeguarding and substance misuse, and also teenage pregnancy. In parts of Devon and parts of Torquay, for example, there would be two of the top 20% areas of deprivation in all of England, and we also have in parts of Devon, in our trust area, we would have 8 to 10% more over 85s than in other parts of England. So we face many challenges across the life course, and as pioneer organisations, we're focusing really in developing our plans around three key areas. The first one is around developing better transitions for young people as they move through services between childhood, adolescence and adult services. The second area of work is around this topic of substance misuse, and the third area is around frail elderly and older people who have comorbidities and who require a lot of dedicated focus to try and ensure that they can stay safe for longer at home. And I think that's similar, as I say, to some of our other colleagues' work. Just to turn for a few minutes to workforce, Jane and Louise and I facilitated a workshop across both trusts. So I am the Director of Nursing in the Community Trust. Jane is the Director of Nursing in the Acute Foundation Trust, and Louise is the CCG lead. And we facilitated in March a workshop with a whole range of multidisciplinary colleagues to focus on the topic of workforce planning over the next couple of years to develop the integrated workforce to lead integrated care. And there were many themes that come out of that workshop, and I'll maybe touch on a few of them if you're happy, Matthew.
Yeah, please do.
I think the first message I would say is that if we're going to enable people of whatever age to stay safe in the community, to have good quality of life and good quality of care, the health and social care workforce is only one part of the solution. So we must work in partnership with many other agencies, including social housing, security, policing, exercise, fitness regimes, schools and colleges, to be able to develop the workforce of the future. For example, developing apprenticeship schemes and strengthening across a whole range of areas of provision, training and develop to enable people to look to self-care and look after themselves. And the whole topic of health promotion and self-care and health protection is a key part of future role development. And we could talk at length, I'm sure, each of us as pioneers, about the future nursing, medical, allied health professions, pharmaceutical, GP workforce, practice nursing, but ultimately it's going to come down to how the public work with us to care for people in the community looking forward as well. So I think that's my first main point about the future workforce. The second one is that we need to develop a partnership approach to workforce planning. And one example of that for me is that from a nursing perspective, to be able to manage people with a number of comorbidities, and 40% at least of our population are living with 4 or more long-term conditions. Nursing needs to respond very differently and perhaps be much less focused on specialist care and more so on strong generalist care across the hospital community primary care interface. And I think the same applies for medicine. GPs enriching into hospital services traditionally, and particularly hospital doctors outreaching into the community to develop workforce plans in partnership that enable people to feel safe and secure across health and care pathways. As far as the model is concerned in South Devon and Torbay, like other areas, we have a focus on developing integrated care hubs. And an integrated care hub, by definition, is a solution within the community whereby people who require support can access same-day assessment, diagnostics, treatment, and signposting. And I think that the term hub is receiving a fair amount of attention, but still needs a lot of thought in terms of what that actually means in terms of the future workforce plan. And this evening, I hope to learn from other colleagues who might have a view on this term integrated hub. And as I move towards conclusion, I would just also say that working with our academic partners, working with colleges to develop the future workforce in terms of both apprenticeship and preceptorship programs and succession planning is going to be crucial. And also in terms of leadership development, because for me workforce planning is part of developing the leadership of the future to deliver safe and effective care across this life course that Jane and Louise and I refer to. So finally, part of that is about good supervision, active learning, being able to develop rotation between hospital and community, shadowing, and being able to mentor and coach the future workforce as they develop a much more integrated view on things. I think, Matthew, I would like to maybe leave it at that point.
Thank you, Bob. So, consideration of the non-healthcare workforce, how the public will work with us, change of roles in relation to health promotion, partnership approaches to workforce planning, integrated care hubs, colleges, apprenticeships, training, and professional development. Let us take some really questions for clarification. We'll take some from each of you, and then we'll ask Bob to respond to all of them. And I'm going to come first to Sanjeev, and then I think I'm going to go to Joe, and then Francis. So Sanjeev, questions for clarification, really.
I was interested to hear about your integrated care hubs in a bit more detail. What do they actually entail, and what kind of size of population do they serve?
Great. Okay, that's clear. But just hold on there, Bob. Hang on. We'll just take a few more. Joe.
So for me, I mean, there are so many synergies with the work that we're doing, but I'm going to ask specifically about your apprenticeship scheme. So certainly in Islington, we're looking at a sort of employment commission, which is looking to how we can develop apprenticeship schemes. And I suppose it was really to ask you where you are in your sort of development of that.
Fantastic. Thank you. Francis.
Thanks. There'll be lots of familiar themes as we go through. I think. Well, just wanted to talk. You mentioned having a workshop and the combined CCG and the two trusts. How much have you got a joined-up workforce plan? Because we've got quite individual organisational plans. So have you got a single whole system workforce plan?
Great. Good mix of questions, Bob. Off you go.
Okay, I might need to ask for the questions to be repeated, but I think I'll start with the last one. We do across both trusts have a workforce plan which is multidisciplinary and joined up. I should say that South Devon Healthcare Foundation Trust and Torbay and Southern Devon Health and Care NHS Trust are working through a transaction process to become a single integrated care organisation over the next year. So we would hope by this time next year we will be a single foundation trust, which is in keeping with the vision that we're all talking about, and that's good. But we currently have a joined up HR, personnel and organisational development function, and the leadership within that function is developing and has been for some time, creating a single workforce plan, and that's, as I say, across all professions. So hope that answers your first question.
That's great. Thank you, Bob. The next question was around your integrated care hubs. What do they entail? Can you just give us a bit more detail?
Yes, Sanjeev asked a very good question, and as I said, there's still a lot of work to be done to determine the definition of an integrated care hub. But for me, it's a single point of contact. Whether our focus is particularly around people who are older and frail at present, but in our area, and your question was also about the population. It could be anything from a small group of 2 or 3 GP practices serving a population of 10 or more thousand, or it could be up to 20 or 30 GP practices serving a population of anywhere between 40 and 80,000, and we're still determining that, Sanjeev. But what I would say is that our vision for an integrated care hub for an older person who is frail is to try to provide a same-day diagnostic service that enables an older person who has long-term conditions, who can quite regularly get into crisis, and that's where we're trying to prevent the blue light ambulance from taking an older person to A&E and when they have COPD or heart failure, and try to get ahead of that crisis, whereby they can have a hub will provide same-day diagnostics and support and signposting and access to rehabilitation in likely a community hospital site rather than in the DGH or the acute facility. But we envisage that both our DGH and one of our community hospitals will work in partnership to provide that. So the consultant geriatrician may work with the diabetologist and the COPD consultant, along with the allied health professions and nursing, to provide that access to diagnostics and support in the hub, an onward referral. And the onward referral may be to the community nursing rapid response team or to community rehab, so that person has continuity of service as opposed to getting closer to crisis where they end up in A&E. And we hope that by working in partnership with the voluntary sector, Age Concern, for example, we will be able to provide an ongoing range of support that enables people through volunteering to maintain day-to-day contact that keeps them out of crisis as well.
Okay, thank you. Let us look at the last question, which Joe was particularly interested in, the apprenticeships that you talked about. Could you just add a little more on that, please?
Yes, I'm relatively new to working in this area, and Jane Viner, my colleague, who's Director of Nursing, longer knowledge in this. But South Devon College has been working very closely with both trusts for a number of years now to develop an apprenticeship model. And there are a range of modules and programs which enable young people, and not necessarily just young people, to access a program of work which enables them to pave their way into the health and care professions. And it's a well-established program now with South Devon College. We'd be more than happy to share the vision and direction of that, but certainly I would just say at this stage that Jane and 1 or 2 other colleagues would have a stronger knowledge than that on me.
Thank you, Bob. So Sanjeev has asked in the chat bar if we can ask follow-up questions, and we certainly can. Joe, let's just stick with this apprenticeship point. Do you have any other follow-up questions or responses you want to give for Bob?
I suppose from our local narrative, it is very much something which is specifically being developed by the London Borough of Islington. And one of the experiences is that we get people onto the apprenticeship scheme, but often it's actually very difficult to get people into the clinical role phase. And it's really all around the management of risk. And so what often happens with the apprentice is that they end up doing performing office functions or administrative functions and never really get the exposure or the experience to the delivering care. So I suppose it's quite how one integrated that into the module of learning and how one managed the risk that was associated with that.
Well, my response to that at this stage, Joe, would be that the apprenticeship scheme with South Devon College is specifically focused on clinical pathways and enabling these young people to embark on a program where they can combine college-based learning with local clinical experience.
Fantastic. It'd be really interesting to talk to you at a subsequent point about that. Thank you.
Okay, thank you.
That's great. Sanjeev, I know you had some other questions.
Yes, thank you very much. I'm really very interested to hear about this approach, because for me, one of the issues about primary care is the need to develop capability and capacity. And I'm interested to hear how the hubs will support the development of capacity and capability for looking after, for example, the vulnerable elderly in the way that you describe. And the second is, for me, is the issue about the risk of segmenting the population in a particular way, which may understandably focus on the very young families or the very vulnerable elderly. But what about the group in the middle? How do you sort of begin to start planning care in such a way that no one is left out of this?
So what I'd like to do is just get some feedback from colleagues around what we've heard from Torbay. And could you share with us the things that you liked the sound of, that you thought were real clear strengths, and what if you could offer advice or suggestions to Bob and Joe and the team in Torbay from your own work. And I'm going to go first to Francis. So, Francis, what did you like? What do you think was the strengths? And have you got any suggestions or advice to share with colleagues from Torbay?
Well, really like the idea of a joined-up HROD function. I think having that sort of level of strategic collaboration between providers has got to be the answer. And certainly picked up this thing about apprenticeships. So I think those are two things that we would really want to emulate in Worcestershire. I suppose one of the things that the sort of legendary about Torbay and South Devon is that they've been at it for a long time. So I suppose that there would be something in terms of reflecting the journey that they've been on and being able to map at what point they had the strategic discussions to be able to get to a position where they have the maturity of relationships. So it's more of a kind of a slightly rhetorical question, really, is that, you know, what was it about the maturity of the relationships that enabled them to get to that point? But certainly the joining up the strategic functions and investing in the long-term planning of the workforce for the future, not just responding to this year's crisis, I think is really good.
Thank you. Any suggestions or advice for Bob?
Get your colleagues to be on the call with you, probably, and, you know, well done for leaving Northern Ireland, wherever you came from.
Okay, let's move on to Joe. What feedback do you have for the Torbay team?
So, I mean, I felt that, as I said again, you know, there are very many similarities to the work that we're doing in Islington, and I think certainly the interesting part for me is about your broader partnership. So often we focus very much on our immediate partners, but, you know, there really is a big part around the development of the social asset piece, which I think is going to be one of the keys to our long-term sustainability, really, as organisations, but also bringing in the broader scope of partners, so certainly housing, the police, schools and colleges. And I suppose it's about how you do that in a timely way, because obviously, you know, we have our as strategic imperatives that we need to deliver in a timely way, but and how one balances that with making partnerships too sort of unwieldy. But I think that for me was a very strong point, that you were already having those collaborative conversations. And I suppose the other thing was to hear that despite, I suppose, we hold you in great esteem for a sort of long trajectory of development, that you're still having these nascent discussions about the meaning of the integrated hub, about the sort of the number of the population that it will cover, around the key elements of it. I mean, I suppose we often feel that we're a little bit behind because we're still having those discussions, but I think it's a commonality that, these things take time to actually develop and come to fruition, in a meaningful way. So those are really my comments.
Thank you.
Thank you.
Sanjeev, strengths that you admired, and suggestions or areas for building that you can advise or suggest for Torbay.
I agree with what others have said about the idea of an integrated approach to HR, organisational development, education training. I'm delighted to say it's a unique thing. I've never come across it quite as well described as that before. I think the notion of this well-developed relationship between the Director of Nursing, the Director of the Community Trust, and the CCG Education Workforce lead coming together and actually working in partnership is actually to be welcomed, and it's a clear sign that actually if you can get people to work together, you can emulate that in the way care is also delivered. I think that's a really positive thing to see. Areas for consideration, I think, are to do with thinking a bit about the capacity and capability of primary care in its current state to support the integrated care hub that you're kind of sort of beginning to kind of evolve. And the second is both the benefits of segmenting the population in the way I think that you're describing with the vulnerable elderly and young families, and thinking a little bit about some of the downsides of that as well, particularly the loss of continuity of care and the continuity of service for families and groups of people. So it's just those thoughts that were going through my mind as I heard Bob talk.
Thank you. Thank you, Sanjeev. I guess if I were going to pick on two other things, I would pick on the question of leadership, which you mentioned, Bob, and how you develop the leadership capabilities across all the partners to deliver this kind of change. And I think probably your thinking on that is more advanced than we've seen elsewhere. And the other thing that struck me was it seems like you're building the culture and relationships first, and then the structural changes following. And so often we do it the other way around. So some reflections on how you, recognizing that simply creating a single unified integrated care organisation and a new structure won't necessarily deliver the cultural changes that you need. How you get those two things to work together. So there is some feedback from all of us. This is your last opportunity to respond, Bob, before we will move on. So just if you could just pull this together for South Devon and Torbay, that would be fantastic.
Thank you, Matthew and colleagues. I lost a couple of minutes in the call, so apologies, but I came in just to hear most of the feedback. Thank you, everybody, for your feedback. There's a lot there, a lot that I can bring back and discuss with Jane and Louise and quite a number of others. I think that I don't want to take too much time, so I'll just take 1 minute to say that the whole challenge of developing the future workforce to create safe and high quality integrated care is one that is going to take some time and a lot of energy and very clear focus. So that point around leadership that you made at the end is probably the one that I'll emphasize. Each of you have said something important, and I'll note that. But if we don't have strong, committed leadership at all levels, of the workforce and across agencies, we're going to really struggle to develop integrated care within a continuing time of austerity whenever we continue to face and will face even more demand from demographic and comorbidity challenge. So thank you.